It's sort of cutting edge, where the idea is to get the body functioning normally again.
Right, balance is key with the treatment. It's called NUCA, so maybe it's headaches or dizziness or both. And that's the case with one of our next guests.
From the Spinal Balance Health Center, welcome back Dr. Drew Drummond, alongside one of his patients, Chad Nelson. Thanks for being here on The Blend today, guys. Chad, let's start with you, because you had some pretty serious problems a while ago.
Yes.
What was going on?
Oh, I'm a real physical active guy, and get too busy, get running too hard, and get real fatigued out, and then get a lot of dizziness and disoriented and that kind of stuff. And
you were getting lightheaded.
Yeah.
And then at one point even passed out?
Yeah, passed out
behind the
several
wheel of
times.
a tractor, right?
Several.
And that's when you said, okay, this is serious.
Yep,
I can't be operating my farm equipment when I've got these problems going on. So what sort of treatment did you try first? And tell us about your journey to Dr. Drummond.
Well, first off, I figured it was something medical, and I went to several doctors, several blood tests for weeks, CAT scans, echocardiograms. I didn't know if it was my heart, what it was. Test after test, blood test, everything came back fine. Everything was normal like it should be, and no one really knew, and I didn't know either.
Right, like, so what gives? Because something's wrong, because you're passing out.
Something wrong. I couldn't work anymore. I was stuck at home for a couple weeks there and couldn't do anything. The migraines and the headaches got so bad I couldn't stand nothing. They actually put me on a prescription painkillers for the migraines and stuff like that for several months.
So you had all these problems, couldn't figure out exactly what was going on. What did you do then?
Well, I went to Dr. Drummond here.
I got to ask you how you found out about Dr. Drummond. I already know the answer to this. How did you hear of him?
Well, I was sitting at home one day. Like I said, I couldn't work there for a few weeks at all. I couldn't get off the couch hardly. And I was laying there, and my dad called me up and said, hey, turn Channel 3 on here. And I said, all right, turned it on. Well, I said it's worth a shot, because nothing else was working. It was doctor's appointments after doctor's appointments, and nothing was working, so I figured I'd go ahead and give it a shot. And
so your dad tells you to call up, watch the Morning Blend. You see Dr. Drummond, you give him a call. Dr. Drummond, he comes into your office. What do you do from there?
Well, he came in. We did like we do with all of our patients, is we look for upper cervical problems. There are problems with the brain stem that are due to the top bone of the neck being out of place. And when that bone is out of place, it causes just widespread problems throughout the entire body, because your nervous system controls and coordinates everything. And the problems aren't always that you need a drug to fix. The problems are such that if you can fix the underlying problems, which in his case was an upper cervical misalignment, we can see relief then with the headaches.
Sometimes we think surgery is needed. We were just looking at video of one of these NUCA adjustments, and it's really quite gentle, isn't it?
Yeah, it's not painful at all. There's very little pressure that's used. It's not a thrusting force. There's no cracking and popping involved. But what it does do is it realigns that top bone of the neck and just gets the communication systems of the body working better, because if your brain and your body are not communicating correctly, there's a number of things that can go wrong. One are headaches and dizziness, but there's just a number of functional problems.
And you mentioned no cracking or popping. Chad, were you surprised at how gentle the procedure was?
Yeah, it really was. It's like nothing's even being done, you know. I mean, I've been to several chiropractors before trying to fix back pain and stuff, and it's completely unlike any other chiropractic.
This is a different story, right? This is a different story. Are you passing out anymore? I've got to ask, have you fainted since you started seeing Dr.
I haven't had the migraines. I haven't had anything.
That's remarkable.
Yeah.
So how do you know if NUCA is right for you, Doc?
Not every headache is because of an upper cervical problem, obviously. Most of them tend to be that way. I'd say well over half that I encounter. But what I need to do is I need to look at a patient. There are some indicators with their posture and some other things that I can look at and have a pretty good idea if it's an upper cervical problem. But definitively, I really have to take a picture and find out what it looks like, and that's when I really can start understanding the problem and whether or not it can be corrected or not.
And we're taking a look at some animation of the spine.
This is the nervous system you're talking about.
Yeah, and what that was, we were just seeing was just how the nerve impulses flow from the brain out to the body, and then there are receptors throughout the body that are sending information right back up to the brain. And if this coordination system does not work correctly, you can end up with posture problems that cause an imbalance and a stress throughout the entire body, and what happens then is just over, you know, in his case, it was a very short period of time, but it can take years before symptoms then just start bubbling up to the surface.
And and sometimes I say, well, it could be this, it could be this, it could be this, depending on the sort of doctor you're going to.
Is this very common where patients have explored so many other options before they come to you? Would it have been nice for you to discover Dr. Drummond before you did all those other things?
Yeah, it would have been real nice and a lot cheaper.
That's funny.
Yeah, and it is really common. This isn't a well-known treatment, and most of the people are sort of funneled toward their medical doctor, and then if that doesn't work, a specialist, and then maybe a surgeon. But the problems aren't caused by medication deficiencies. Those can kind of help suppress some of the symptoms. But if you don't get to the underlying cause, you're kind of spinning your wheels.
You know, Dr. Drummond is a real rarity. Honestly, I think are there like 200 NUCA doctors in the country, something like that. So we're fortunate in the world. Even better. All right, so a special offer, which is part of what got Chad interested in your doors, and you're doing something similar for our viewers today. I know the response is going to be strong because there are so many people with headaches and dizziness, other problems. The first 30 people who call Dr. Drummond's office, you get a consultation, an exam, and then those ever important x-rays, which can be expensive, but that whole package for just $50, but you've got to be one of those first 30 people to get in on it.
Yeah, of course, it's a big value, and if you're having a lot of problems and you just can't figure out what it is, gosh, this is the time to give them a call, 452-3400 or spinalbalancehc.com, or you can see his email address right there, spinalbalance@yahoo.com.
Dr. Drummond, it's great to see you, and thanks for bringing us another success story. It's so neat to think that a guy, 25 years old, all that stuff going on, and now he's doing well. Thank you, Chad.
Thank you.
Thanks for coming in. Thanks.
Well, coming up, how technology...